Welcome, everyone. We're so excited to see you all here today. Thank you for joining us. My name is Kim Bart, and I am the Director of Student Affairs for our Phoenix campus in the College of Public Health. And we're really excited that you've joined us today for our Fall 2022 Virtual MPH Internship Conference Student Highlight event. So very long name, but very exciting event for us. We're excited to highlight our students. We have 3 student panelists today, and with us in the audience, we have current students, faculty, preceptors, and maybe even some prospective students. So we do want to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being the home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through educational offerings, partnerships, and community service. So as you may know, our Master of Public Health students from Tucson, Phoenix, and our online programs conduct internships in communities around the world. This internship experience serves as an integral part of the MPH degree curriculum, in which our students are able to use their academic knowledge from the classroom in real-world practical situations with professionals in public health settings. These hands-on culminating experiences benefit the students and the organizations alike. We are so grateful for the collaboration between our students, faculty, and the agency preceptors, particularly to those agencies who help our students with this hands-on learning. This virtual internship conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with those community organizations. And coming up next, you're going to get to meet 3 of our MPH students and Fall 2022 presenters, Lameman, Amaka, Okpara-Oguadimma, and Calli, Stewart. And you're going to get to learn more about their internship experiences. After our student panel, we'll give you some additional information about the conference, what we call the conference, how to access our student presentations, and how to view them and how to evaluate them. So stay tuned for that. So we are going to jump right into our panel. We are very happy to welcome our 3 student panelists, again, Breanna, Amaka, and Calli. They're representing all 3 of our campuses. So we have online, Tucson, and Phoenix campuses represented. I'm going to introduce our students by way of their brief bios. And then following that introduction, we're going to start with some questions. So I have some prepared questions. We, as the coordinators, have prepared questions, but we want this to be as beneficial to everyone in the audience as possible. So please feel free to jump into the chat or raise your hand to ask questions. Certainly, we don't need to get through our list of questions if you all have questions. We would much rather hear from our audience, but we do have a set of things to get us going. So I'll start with introducing Breanna. Breanna Lameman is a member of the Navajo Nation. She currently resides in Shiprock, New Mexico. She's a second-year student at the University of Arizona in the MPH program in the concentration Health Behavior Health Promotion. She intends to graduate this fall, so congratulations, Breanna. Her internship program was called the Program and Evaluation Plans for the Nurturing Plants Program, using innovative hydroponics technology to connect rural Navajo families to contemporary food systems. She has a bachelor's in public health, the concentration in health promotion from U of A, and her public health interests and passions are Indigenous health disparities, Indigenous foodways, and Indigenous food sovereignty. Amaka is a second-year MPH student in our Health Services Administration concentration here in Phoenix. She anticipates graduating this May 2023. Her undergraduate degree is in medicine and surgery from Nigerian University. And her internship was on the research, and it's called the Validity of EHR-Based Detection of Delirium using the NOVAD algorithm. And her public health interests are designing health services programs for homeless and refugee population. And last but certainly not least is Calli Stewart. She's a health behavior health promotion student in the online MPH program, and she does anticipate graduating this December. So congratulations, Calli. She was a development intern for the Rain Foundation and has a Bachelor of Science in Public Health. She has professional experience on the COVID response unit for Maricopa County Department of Public Health and as a promotion and prevention intern at the U of A campus, University of Arizona Campus Health Department. Her public health interests are women's health, sexual health promotion, and family and preventative care. So welcome to you 3. I'm loving the diversity of programs and interests and internship experiences. This is great. So our first question, and I think one that everyone in the audience will appreciate, is if each of you could take a turn in briefly describing your internship experience. So like the elevator speech of your internship, like where it was and the basics of what you did to help orient our audience to your experiences. And I'll give a chance for someone to choose to start before I call on someone.
I'd be happy to start. Oh, you can go, Bree.
Okay. All right. Thanks. Hi, everyone. My name's Bree. I just kind of like to give you a quick introduction to where my internship was. So I did my internship in Nanazad, New Mexico, which is located on the Navajo Nation. And so I work with two Native-led organizations called Dinan Introspective and Navajo Ethnos Agriculture. So they're both focus in agriculture, but also focus on community-based programs. And so I was able to help assist in planning a program plan, but also an evaluation plan for the program called Nutrient Plants Program, which is kind of introducing individuals about hydroponics and how it can increase food security and traditional foods in the Navajo Nation, especially in rural and remote areas. Thank you.
That was great. Thanks, Bree. Calli.
Thank you. Yeah, my name is Calli. Thank you for the wonderful introduction, Kim. I work with the Kaya Rain Foundation. The Kaya Rain Foundation was started in 2019 by Lisa Cohen, who is here today. Thank you for coming. The foundation was unfortunately a tragic beginning with Lisa's loss of her daughter Kaya in 2019 due to a food allergy exposure and anaphylactic reaction. And ever since then, she has dedicated her life to education about food allergies, prevention of food allergy exposure, and expansion of epinephrine availability to all. So when the program began, they were working on getting epinephrine available in Maricopa County and Pima County schools, which has been a wonderful program. They worked with the SSMP, which is a nationally recognized program that gets epinephrine auto-injectors in schools unassigned to be used for anyone who might have an anaphylactic reaction on campus. And her program was able to increase enrollment from 2% to almost 30% in Maricopa County and Pima County schools. And when I joined the team, I joined to develop the course from schools to be focused on restaurants. So we developed a course for restaurant staff members to take and train them on how to use epinephrine and how to save lives in restaurants when it comes to allergy reactions.
Great, thank you, Calli. Amaka.
Yeah, thank you, Calli. My name is Amaka, a second year MPH, just like Kim explained, second year MPH student of Health Services Administration concentration. My internship was at Breanna University Center, Phoenix, under the medicine department. And the focus was on a tool for detection of delirium. You know, delirium is a preventable disease, is a preventable health condition, but when it's not managed, it usually progresses to dementia and can render individuals solely dependent on the public and government. So I developed interest in that research topic when I saw it, because considering the burden that poses on the government and the public, and when it is preventable. So it was a good experience for me at the Breanna University Medical Center, Phoenix. Thank you.
Thank you all. One thing I love most about this student highlight event is realizing, again, is having it sort of shown to us again, how different our student experiences are and how different their interests are. And I think that's one of the, kind of core tenets of the Master of Public Health program, is that we know people are interested in a variety of ways of incorporating public health into the community, into medical centers, into foundations. And so we certainly love seeing that represented with our students. So another question we often get from students that we'd like to ask you as well is, how did you find your internship? And what resources did you use to help locate that internship? And anyone can jump in.
Okay, I can start. So when I was seeking for a place to do my internship, of course, I didn't know so many places. So I consulted with my coordinator and my professors and my mentor. I explained to them the kind of internship I'm looking for, the kind of areas I want to cover in my internship. So each one of them, I accepted to source for see that if any opportunity comes out, they will inform me. So they were posting things until my mentor posted this internship, and I saw it was something I actually really wanted. So that was how I got the internship at the Breanna University Medical Center.
That's great. So using your connections with faculty mentors and faculty, that's excellent. Calli or Bree?
Yeah, I also used some of the resources that were provided by our faculty mentors. I remember going through the list of the possible internship sites, and something that I was looking for and was important to me was looking for women in leadership. I've been lucky to have women in leadership almost in my entire public health career. And when I did my interview with Lisa and Dr. Michelle, I realized that this foundation, they weren't in it for the money, and they aren't in it to do anything other than help people and promote safety. And I felt really drawn to their purpose. And that was why I ended up going with their program. And I'm really glad that I did.
Awesome. That's excellent to hear. Great.
Yeah, so how I secured my internship was I was already connected through Dana Introspective, so I was kind of already partnering with them. And we, little did we know that Navajo Ethnos Agriculture was just located right down the street from us, kind of down the river. And we ended up kind of collaborating and partnering and looking for partnerships to help us build this program. And so we decided to collaborate with one another and just kind of build something that's very unique, but also really needed in our community. So in a way, I already had those connections already made and those relationships already built upon. So we were able to create I was able to secure my my internship just kind of based on networking and already connections already made.
That's great. And I would say, and I'm sure Sam and Tanya, my colleagues here, would echo that those are three of the pretty typical ways students are finding internships: through faculty connections, through resources on the hub or faculty mentors, or through relationships they've already built and they want to expand on the work that they've already done or are working on. So for those prospective interns in the audience today, those resources, we can tell you those things, but we know that when your student colleagues tell you those, it's sometimes more meaningful. So I appreciate each of you sharing that information with us. So if there's any questions from the audience, certainly you can jump in at any point. Again, you can raise your hand, you can use the chat. I'll continue with our questions until I see one of those. So we would love to hear any unique experiences you might have had during your internship. And when we say unique, that might mean something very challenging that you faced, something just really interesting that happened, a twist, a turn you didn't expect, or just something that you thought was really special that you were able to do or create. So really any of those, we'd love to hear about them.
Okay, so let me take it. So I will call it my challenging to me. When I started the internship, I didn't know I would be able to do what I did during that internship in terms of statistical analysis that I carried out in the research. Before that, I didn't really understand how much I've learned in biostatistics and epidemiology until I was faced with the real life situation to conduct statistical analysis, collection of data and all that. So it was quite challenging, but at the end of the day, it was quite an experience for me and very favorite experience for that one. And another thing was the poster presentation of the research. It was my favorite moment that we were able to participate in the poster presentation of the research at the Arizona Geriatric Society conference. That was on November 5. So it was a good experience for me.
The Epi-A and Epi-B out there, right? You don't know that you're going to use it. You really are. You really can. By all reports I've heard for Amaka's experience, she did a great job with the data. So that's great to hear. Calli and Bree.
Yeah, I think what was most unique or maybe challenging for me was the technical aspect of the internship. when the topic was introduced that we're going to be developing this course and we're going to be using Articulate 360 and Canva and doing a lot of work with graphics and design. That was not something that I was very familiar with. But I got a lot of experience and practice, and we did it. We made a course. It's published. It's published to the Western Regional Public Health Training website. It's free. It's 10 minutes for everyone to go and learn about food allergies. And that getting that published and having it completed just feels like a huge accomplishment. And I did do it with a team of other interns. But just having your name on there is something really special. And I think that was a really unique experience. And now I know how to use all these really great graphics, and I can use that in my future career for marketing or, graphic design or whatever I might need it for.
Yeah, sometimes it's the things you don't know you're going to learn that you do learn. And I like the point you made. You did it. I mean, that's really exciting. That's really great. Bree, any unique or interesting experiences during your experience?
Yeah, I think for me was having to, in terms of creating the program plan and evaluation plan, is that it wasn't just an individual such as myself doing it. It was a collective and community effort. And so it was led by the community for the community. And so I got to create a Indigenous advisory board to help create this program plan and evaluation plan for the Nutrient Plants program. And so it was pretty much built upon the Diné or Navajo culture, language, and just kind of agricultural practices, and integrating it with hydroponics. And so some really cool things is that we got to build our evaluation on an Indigenous evaluation already. So just using those frameworks from the Urban Health Institute. And so just really using what's already out there for Indigenous communities and implementing it in our own community, but tailoring it to the Navajo culture. And so that's something I was, myself and our board were able to do, and just kind of, play with it and to fit our needs for our community. So that's something that I think was very unique, but also challenging, just because, it takes time to develop these frameworks that meet the needs of the community. So it was something special to be a part of, but also have others collaborate and make something really awesome.
That's really great. Do you think that that is going to sort of improve the sustainability of the program? Is it really enmeshed in the community?
Yeah, so we actually already implemented this program in the community. And so it's going through an evaluation or analysis right now. So we're going to really see if this program fit the needs of the community and if there's anything we need to do in terms of improvement of the program, but also the hydroponic system as well. See if it was doable for the communities and if it benefit or also increase food security in terms of vegetable and fruit consumption.
Wow, that's super awesome. That's really great to hear. Thank you all. So we'll just keep going. And feel free also, panelists, if there's other information that you really feel compelled to share and I haven't asked the question yet, you can always jump in and share some extra information. I feel like our questions do a pretty good job as we get through them, but definitely we don't want to leave here without you having shared everything you want to about your experience. So this is really the connection point to public health. But how do you feel that your experience, your internship contributed or will contribute to the field of public health? So that big picture question about your particular internship, how do you think it's going to contribute directly from what you did?
Okay, I can take that. I worked on delirium, early detection of delirium in a healthcare facility in older patients. And delirium is a very important issue for public health because it's got, just like I mentioned earlier, it's preventable. In hospital settings, it's preventable, but it can cause a lot of morbidity and mortality. And when it's not prevented and a patient is subjected to that, down the line, those patients, most of them don't recover and they end up with dementia or end up in long-term care, being highly dependent on the public and the government. So any way that delirium can be prevented is a plus for the public health and for individuals. So that's basically how it affects public health. And secondly, because those patients, when they stay long term in the healthcare facilities, it increases the cost of care, burden on the healthcare facilities, and increases the burden on the families of the patients, and increases their duration of stay in the hospitals, which can equally predispose them to other infections in the hospital setting. So it's a very, very important issue that, when handled, when managed, many people and then the public will be in a safer position.
And you said you did statistical analysis. So did the statistics show that the tool that they're using is significant?
Yes, the statistical analysis, luckily the statistical analysis we did was to find out the sensitivity and specificity of that tool, the NOVAT tool for detection of delirium. And it showed that it is sensitive in detecting delirium. So that was the result of the statistical analysis. So possibly in future, we are working on there's potential for the manuscript publication on that too.
That's awesome. Thank you so much. Calli or Bree?
Thank you. Yeah, so the public health impact for my program reaches a very large number of people. About 32 million people in the United States have food allergies. And 1 in 3 of these people report experiencing a food allergy reaction in restaurants. And oftentimes this is due to cross-contamination or accidental exposure. It's not necessarily due to being knowingly served your allergen. The restaurants are the number 2 location that people report experiencing their first allergic reaction ever. They maybe never even knew that they had this allergy. Of course, it would be behind being at home. And the state of Arizona alone hosts around 9,000 food service establishments. And the National Restaurant Association has more than 1 million restaurants. And so this is kind of the reach that we're talking about when we talk about how many people and the public health impact that this program can help. And within those restaurants, there's about 14.5 million employees who would take the training, take that knowledge with them, and take it with them the rest of their lives, and focusing on safety and prevention. But then they are also taught what to do in the case of an emergency and how to acquire and store epinephrine on site. And so that's a pretty large amount of people that we are reaching out to, that this course is now made available to for free.
Yes, I was just about to say that. What an expansive reach. So certainly making a footprint with those connections between your project and the field of public health.
Yeah, this is one of those interesting fields too, where no news is good news, right? You might not necessarily see that what we want to see the numbers go down. We want to see nobody reporting food allergies, and that's what hopefully the effect of the course is.
That's awesome. And how about for you, Bree?
Yeah, so I think with my internship, it touched on a lot of different aspects in terms of just like program planning, evaluation planning, that it's not an individual thing, it's very collective, how you can use community assets, use community expertise and knowledge to create something that is for the community, and knowing that the community knows what's needed in their area. And so just realizing also just kind of really understanding that with my internship, it also helped develop a program. And in terms of addressing kind of climate change, the lack of access to food, kind of touching upon food insecurity in the Navajo Nation in terms of it being rural and remote, but also realizing, excuse me, that's my cat, realizing that individuals live in rural and remote areas, and they tend to not have access to, the grocery stores. In the Navajo Nation, there's only 13 grocery stores. There are lack of water infrastructure. And so with that, realizing how hydroponics can be implemented in the household, inside, but also inside, and realizing that hydroponics doesn't use soil to grow food. And it uses a water-based nutrient, and that this water-based nutrient can be recycled. So having to recycle this water over and over for at least a month can really provide benefits to rural areas to increase food access. And then just also kind of providing education about climate change and the environmental toxics in the areas, and how extraction is a huge issue on the Navajo Nation, and how realizing that, there's water contamination, land contamination from these extractions, but also addressing how can we address these issues in our area, but also how do we continue growing our food, and how do we access our food, nutritious foods, considering there's only 13 grocery stores, and sometimes those items tend to fly off the shelves really quick, or they can be very expensive, especially if you're looking for some leafy greens, some fruits that you could possibly rely on a hydroponic system. But also realizing this hydroponic system isn't a solution. It's not replacing any traditional knowledges in terms of growing on the land. It's just a supplement to growing additional foods in rural areas that don't have access to quality land, water, and just realizing that addresses so many issues in the Navajo Nation, but also realizing there are community assets in the area. Thank you.
I'm so sorry my internet went out. It crashed a little bit, so I'm back. So are we still talking about the public health contribution question? Yep. Awesome. Yes, that's great. Amaka, I heard you say the test was sensitive, so that was good, and specific, that was good. And then it crashed. And Breanna, I think I caught most of your response. Calli, did you have a chance to answer that question? You did. Okay. I'm sorry I missed what you were able to share. But thank you to, I'm guessing Tanya jumped right in there and got it going. So I appreciate that. Do we have any questions from our audience as we continue? No? Okay. So the next question we had is more specific to you as a person and professional, is how do you think this internship is going to help you on your career path, or is going to be sort of part of your career path? Walk us through that a little bit. Maybe we'll start with Calli.
Sure. So I have very minimal actual work experience. I graduated in 2020, and I worked with the Maricopa County Department of Public Health for about a year before I joined this internship program with the Calli Foundation. And in your MPH, we do a lot of practice of what we're going to do in real life, right? We do practice program plans, practice community health evaluations, practice research for projects. And this is a great example of real life actual experience. We did in-depth research on the topic before we developed the program. We made a program and we published it, and it's done. And just being able to work through the actual process of that and troubleshoot real problems that come up. We had to make a Spanish version of our course. That was something that we maybe didn't anticipate at the beginning, but then at the end, when it was published, we realized, wow, a lot of our audience is Spanish speaking or primary Spanish speaking. And in order for this to have the maximum impact, we should make it accessible to them. And we did, and we published a Spanish version. And I think just having real life public health experience has been such a great benefit for me and my career, because now I can say I actually did this program rather than, oh, we did a practice one in class, which is also very helpful, but it gives some more authenticity to me as a professional.
I think that's a great word, authenticity. So, we like to think in the program that you're learning a lot in your classes, but it is just so different than when you're doing it in real life. It just is. And there's real life hiccups and consequences and benefits. And so I think you highlighted those well. Amaka or Bree, how do you think it's going to help your career trajectory?
Thank you. Like Kim mentioned, my undergraduate degree was in medicine. And after my graduation, I was opportunity to work for some years So within these years, I was able to see the need for me to understand more about how leading healthcare organizations and be able to lead healthcare organizations in such a way that it can actually impact the public, not just at the individual level, being able to handle healthcare organizations to be of great impact, positive impact to the public in general. And that's part of the reasons that brought me into this program. So having done this is like a plus for me because it gave me an opportunity to understand more about so many things about healthcare organizations here in the US. Doing this under Breanna University Medical Center, I went through so many modules on the administrative and the regulatory requirements that you need to go through before you can conduct a research in a healthcare facility. So that was a great experience for me and a plus for my career goal. And understanding this research, which has a huge impact on the public, is a plus for me because my career goal is actually to lead healthcare organizations to be able to create programs that will influence the masses through healthcare organizations, and that's a good plus. And again, in my residency program, because I intend to do my residency after this MPH as well, so it's equally, the research will be of equally additional plus for me in my residency.
That's great. I know Amaka and I have had many a conversation about career development and career paths. And so I was very excited when she found this internship that was going to sort of bridge things for her. Bree, I'd love to hear more about your career path with this experience.
Yeah, so with this internship that I did, it really helped in terms of developing meaningful and respectful relationships within my community. I was able to learn more about my community members, who they are, where they come from, and their expertise, but also just realizing that it really helped me become a better Indigenous public health researcher, a better relative to my people, to my community, and really understanding what's needed in my area, and kind of just building off the assets of my community and using resources to build something for the community. But also with kind of the program planning and evaluation planning, it helped me become well informed in managing public health programs, how to pretty much in Indigenous communities, and also how to develop the abilities and skills to develop a plan, how to implement this plan that I created into the community, and then how to assess also. But also realizing that it improved my understanding about Indigenous knowledge, kind of cultivating and sharing knowledges with others. So if something that I lacked knowledge in terms of my culture or tradition, my community was able to help me develop, or help me really understand what I was missing in terms of creating this program. But it also kind of contributed to pretty much kind of a public health innovation and creativity in my field. Just using my community, kind of using my culture to develop something that's really meaningful to us, and just, but also having hands-on and education, providing hands-on activities for myself and others, but also addressing the needs of the people. So this experience really helped me gain necessary tools and knowledge to become a strong leader within my community that I intend to be. So that's just something that I kind of gained through, helped me with my career path, but it's just also to develop those meaningful relationships because I intend to do more work within my community.
I think what you said is, what everyone has said is really valuable, but what I appreciate about what you said, Bree, is that it isn't just the skills. The skills were incredible, but it is, and the chance to practice those skills, but it's the relationship development and the relationship building, particularly when you want to continue working with that group of people. You're able, sometimes it's the social work that you're putting into the internship that we see lots of value in, and we don't often give that enough credit when we're focused on competencies and programmatic things. We forget about the people that you are developing these relationships with, and so I appreciate you highlighting that for us. So I would ask, what do you feel like from your, as I just mentioned, from your MPH curriculum, what was maybe the class or the classes that most benefited your experience in your internship? Like, did you feel like you brought the most skills from? So like Amaka, you might say biostats A and epi A, right?
Yeah, okay. So for me, this internship was like bringing together everything I've learned. I mean, health services administration, the research was in the healthcare facility. So I went through so many models on administrative and regulatory aspects of conducting a research in a healthcare facility. But most importantly, in the conducting the research itself, I applied my epidemiology and biostatistics. That was huge for me. I didn't know I understood that much, but I saw myself doing it. So it was very helpful. At the stage you are going through those epidemiology and the biostatistics, don't just think it's just it. You will need it. When the time comes, you see yourself doing what you don't even, you never knew you could be able to do. So that it was very helpful for me.
See, everyone who's in the room, don't skimp out on biostats and epi. I saw Dr. Sue here earlier, and Dr. Foote would be very pleased with that answer as well. Calli or Bree, my daughter's joining us for a little bit today.
Oh, nice. Yeah, so I took Dr. Gerard's public health policy class in my undergraduate at the University of Arizona. And I didn't think that public health policy would carry me through so far. I think it's probably been almost 4 years since I've taken that class. But his contribution has been great. I did not realize, well, I ended up doing a lot of work with Good Samaritan laws in relation to epinephrine use in a public setting or in a school setting. And so the public health policy and laws around administration of epinephrine in the case of an emergency situation were something that I focused a lot on, and I used the resources and the skills that I gained from that class. And Dr. Gerard is a very interesting teacher. I'm sure you all know him. And that was something that I really utilized along with just evidence-based practices and research classes, because of course there was in-depth evidence-based research that had to be done.
That's great. I'm happy to hear about the policy aspect. I was just reading about Good Samaritan laws the other day, so that's really interesting. Bree.
Yeah, I think a majority of the courses really helped me in terms of with Martha Monroe's class, the evaluation, planning, program planning, implementation, and evaluation, along with Dr. Nicole Yuan. I took some courses with her with the public health policy and research. And then also, I do want to give a shout out to Dr. Stephanie Carroll with the Indigenous Research Ethics. A lot of the courses in Indigenous health were really beneficial to developing Indigenous frameworks and using community-based frameworks as well. Also, I think another class is multicultural health beliefs with, I forgot what was the professor's name.
The Dr. Yuan who still teaches that? No, it's not Dr. Yuan.
I think it was Marie. I forgot her name, but she was another beneficial to, just learning more about different types of policies and different cultures and just how they integrated certain frameworks within their own program plannings. And so a lot of the courses that I took in health promotion, health behaviors was really crucial to my, internship today and how to create, our own programs and how to be well informed in creating and evaluating.
I wish all of the instructors and all of our faculty could be present to hear those things that you all share and how, because I think sometimes they don't see, right? If they're not your internship chair, they're not seeing the skills that they've helped teach you come through. Yes, Dr. Cutshaw will tell them. Yes, that'd be great. Share that information. So I have one last question. Again, we'll open it up to the audience after this. But what is the parting advice that you would give to MPH students, or really anyone looking for an internship or about to embark on that journey? What's parting advice that you would give them? Something either that you were given that was really valuable to you, or you wish you would have been told as part of your experience. So something you would share with them.
I can start. I was really intimidated to start this process. I work with two really amazing women in their field who are very well established, multiple degrees, and I was a little nervous to approach them. And we had weekly meetings, and slowly over time, I got to know them better and connect with them personally. And I think what I would tell to a future intern is, don't be afraid to meet your heroes, and don't be afraid to ask questions and let them know when you're struggling, because even though they're, this big person with multiple degrees who have accomplished so many things and a huge role model to you, they're still a person, and they understand that you're in school and you have multiple jobs and maybe you have family and whatever all the issues are. And don't be afraid to develop those personal relationships with them, because just like you mentioned earlier, the professional aspect is amazing, and that's going to come and that's going to happen. But also the networking that you do and just the personal growth that I've been through is amazing.
That's great advice. And I see Maria said this was her question, so I stole it from you, Maria, but we'll continue. Amaka or Bree, do you have what parting advice would you give?
Okay, so
Yeah, I think what
I can tell anyone planning for internship is please start on time, start early. I started early, and that was very helpful to me. I started my internship in summer, and it progressed into fall. There are some, especially if you are doing anything involving research, human research, or whatever, but you need to start on time, because there are so many things involved, so that you can go gradually and be able to achieve everything that you want to achieve, so that you won't be in a rush for anything. Because I started in summer, in fall, and we are still working on our research, because we are progressing towards the publication. So start early, and don't be afraid to ask questions. If you're confused on anything on how to approach your internship, ask questions. From my experience, the coordinators, the professors are ever willing to help. No matter what your questions are, they're ever willing to help, to guide you. And that's how I went about the whole thing, and it favored me. So that's what I can tell anybody that is planning this. Don't be scared to ask questions. And when you find yourself in your internship, still the same, ask questions. People are just approachable. People are willing to help you. People are willing to assist in any way you are confused. That's it. So thank you.
We did not pay her to tell you to start early, although we definitely agree with that advice. Bree, I'd love to hear what you have to share, and then we'll answer the question in the chat.
Yeah, I think ditto to, I think all the ladies explained pretty much what some advice you need before you start. But again, yeah, start early, plan ahead, start your first year when you're not unsure where to begin, but you have multiple kind of ideas of where you want to start. Kind of reach out to multiple organizations or apply to multiple internships, because you might not get it, or you might end up with having acceptance to all internships. But just realizing you do have options, and just to really utilize your resources, your networks, and that's just some of the things that I would pretty much give advice to.
I think that's great advice. Maria said start the first or second year. Maria, I think it depends on the program you're in. Most of us would tell you that, just like Bree said, starting to think about your internship, starting to build connections, starting to kind of feel your way into where you might want to go is really important in the first year. And then in terms of actually we have COVID in this house. In terms of actually planning the internship, that's usually done 1 to 2 semesters prior to when you want to start the experience. So again, it depends a little bit on your program. Online's going to give you a different answer than campus program. So reach out to your coordinator and we're happy to help you talk through that. Shadira, what is the internship duration? 6 months, 1 year. So I'll give you the coordinator answer, and then I'd love to hear from our panelists how long their internship has lasted. But for us, it depends on what you want to do, and it depends on your site. For the campus-based programs, it usually takes place over 1 to 3 semesters, depending on the student and the site. For online program, it takes place over 3 semesters, is how it's designed to go over that whole second year. But from our panelist perspective, how long, I know Amaka, you mentioned you started in summer and you're still working into the spring on your experience. But Calli and Bree, how long was your internship experience really from when you started? So after your plan was submitted and you started your experience to now, how long has it been?
So I started my internship late, and I would not recommend that. It was very challenging. Thank you to Samantha Pierce so much for working with me and getting me through. And I would not recommend that at all. But I did mine over 2 semesters. I had technically started working with the Calli Foundation last spring, but I did not formally start my internship with them and complete my internship paperwork until last summer, and then I'll complete it this fall. It's been okay, but to all the future interns out there, yeah, I would just like to repeat what the other panelists have said. Start early. Don't wait, because you'll end up interviewing with multiple people and it might be hard for you to choose, or maybe you'll interview with a couple people and it won't work out. So yeah, definitely start early. And I did mine over 2 semesters, even though I'm in the online program and that's typically 3. It's been challenging, but my internship team has been really wonderful.
That's great to know. And again, thank you for the plug about not starting late. We like that. Bree, how long was your internship?
Yeah, so my internship began in June of this summer, so June 2020 or 2022, and it ended in August, so kind of late August. So I completed it, yeah, this summer, and pretty much did the whole summer doing this internship with the program plan and the evaluation plan. But it also, after my internship, I kind of still went through with the plans of the program. And so we got to implement the program into the community. So as of right now, it's still being under doing an analysis. And so again, yeah, start early, because you do have a lot of paperwork and you do have to go through the IRB, determine whether it's research or not human research. So that's kind of the wait in terms of once you submit your application, you do have to wait for approvals before you can begin your internship.
Again, we did not pay her to say that, but we do agree. So thank you. Thank you all. So yeah, you can see that the experiences can be very different in length. Sometimes that's driven by the project and their needs and their requirements for deliverables. Oftentimes it's also kind of a negotiation between the student and the site, or in Bree's case, right, the continuance of what feels like a continuation of the internship, although the formal internship was done over the summer. So we see lots of situations like that. Alexandria has a question in the chat. So she really wants to know how much you applied what you learned in previous classes and experience versus learning during the internship. So for example, in Bree's case, did you know much about hydroponics before you started the internship, or was that part of the learning process for you?
Yeah, so before I began, I knew about hydroponics. I was very intrigued and interested. Excuse me. I have 3 hydroponic systems before we started creating the program. So I was really intrigued by the systems. However, they were super expensive, $1,000 a piece, not including the solutions and everything else. So we ended up creating our own hydroponic systems for less than $150. So we knew we wanted to teach others about this awesome system and how to grow food efficiently and kind of be water conscious about it. And in terms of the classes, all the classes that I took were very beneficial in terms of creating the evaluation plan, program plan, using certain frameworks, theories, and using community-based research and using those skills and knowledges that we learned from class into the public health experience and internship.
That's great. And then and I'm really interested about that $150 hydroponic system. I might send you an email on that one. So Amaka and Calli, I know we talked a little bit about what classes you felt were most valuable for you, but did you have previous experience in some of like the skill sets that you used most in your internship? Or was that part of the experience was learning those for you?
Okay, thank you. In my previous experiences that was very helpful was my medical knowledge, because the research is a medical, you are dealing with patients in the hospital setting. So I applied my medical knowledge in understanding the delirium and its impact and in terms of patients, and then now applied my MPH knowledge in understanding its impact at the population level. Having understood, my health services administration was very helpful in that aspect. Understood the impact of not being able to manage certain things, poor outcomes that now result in burden on the public, raising the healthcare cost on the government, increasing duration of hospital stay and all that. So it was, that helped me, my medical knowledge helped me, and equally my MPH knowledge helped me. And that's how I was able to, I was balanced, I understood the research very well, and that's helped me to conduct the analysis and was able to report it properly.
That's great. So really for both of you, combining some of your sort of previous interests and knowledge, and then the skill sets that you learn in the MPH. Calli, what about you? I know you had mentioned Canva and some other things that you learned really on the job, but what were some other things for you?
Something that was major for me that the program maybe indirectly supported me with was I'm part of the online program. So just being able to use Zoom and coordinate across different states and coordinate with people who have different schedules. Some of my other interns in classes, they work in hospitals or they work in surgery. And so we have to plan around their scheduling. And so the online MPH program really prepared me to do this online virtual internship in that way.
I think that's a very under thought of skill set that we don't often pull into play, but I think that that's really important. When you're remote or you're managing multiple things, and part of the skill set to be able to do that. So thank you all so much. I just am looking at the clock, and for somebody who moderates this session once a semester, I'm terrible at keeping time because I'm so interested in hearing what you all have to say. I think we might have time for one more question from the audience, if there is one, before Sam and Tanya are going to share more information about the conference. So if there's one short or brief question, we'd be happy to entertain that. And if there's not, I will just say from the bottom of my heart, and I know my fellow coordinators, thank you all so much to our panelists. It's been wonderful learning about your different internships. I intentionally don't watch your presentations yet because I want this to be the first time I'm really hearing and learning about your experiences. It's kind of fun for me that way. But I go back and watch them after. Yes, Tanya.
Yeah, I don't see any other questions from the audience in the chat or hands raised, but I have one. If I could be the last question,
yes,
I would really like to know what your favorite part of your internship is, or what is the favorite thing that you're going to take away from your project?
I'll go first. I think my favorite part in terms of this internship was just kind of coming together when it came to creating a survey or creating the program, but just really coming together and seeing family, friends, and colleagues, and just kind of working together, but also coming together with food. So towards the end of, working hard, we had food at the end. So it's just kind of like a celebration when we came together, just because of how COVID really impacted our communities, and just having to build those relationships all over again and just reconnecting. So that was my favorite thing, considering a majority of my coursework was online, just kind of staying home. So just being able to get out there and talk with people and just make those connections again.
Okay, thank you. For me, my favorite part of this internship is that it's fulfilling for me because I'm on the path to making an impact in the population health through this research. You know, making an impact on where health services are administered in order to impact the public positively. So it's so fulfilling. If this research is published, is an accomplishment for me.
That's really exciting. Calli.
Yeah, thank you. I think my favorite part of this experience was working on a project that has pure, I think pure is probably the best word I'm looking for, motives. The motive, it's not financially motivated, it's not fame motivated. There was only one goal here, and it was to help people prevent death and, you know, carry on Kaya's legacy. And that's what we're really doing here. And in public health, we work with a lot of nonprofits, but then of course we know healthcare can be very financially motivated and have different goals. And I think going forward in my career, I feel really motivated to align myself with passion projects like this only, and make sure that the impact is, again, like a pure motivation to help people.
That's great. Thank you, Tanya, for asking that last question. I think that was a great way to end the session. So I'm going to pass it off to Samantha Harris, who's going to share some information about the presentations.
Awesome. All right. Thank you so much, Kim, and to our presenters for getting this discussion going. I learned a lot. I'm super excited for all three of you and your next steps. So I'm going to talk a little bit about the conference itself. So first, we would like to thank all of our wonderful internship sites throughout the state, nation, and world with whom we work to improve the state of public health. The internship conference serves as a professional opportunity for our Masters of Public Health students to share their applied practice experiences, and has been one of the most impactful and practical components of our program's curriculum. Since its establishment, the MPH Internship Conference has grown in stature and significance, and the college uses this event as a public health networking tool by inviting public health practitioners, partners, and alumni through the state. The key to its success lies in our students' participation and in this panel and the exceptional student presentations. So through contributions they have made and the benefits they have gained, the internship conference reflects the undeniable handprint of MESCOV students on public health projects and agencies throughout the world. We sincerely thank you all for coming to our virtual internship conference student highlight event. And for those viewing this recording, hello and thank you for watching. Like I said, guys, this is going to be recorded and a lot of our people are going to be watching this after that fact. Next, this is a link we're going to put in the chat, but it's a link to a form for this live event. And we would appreciate if you all could take a few minutes to complete the form. It just helps us make it better for the next time we do this. Like I mentioned, our Kim and Tanya have been doing this for a very long time. This is the 4th semester that we've been able to include our online population, so we hope to continue to grow it. I'm now going to pass it over to Tanya, who's going to talk a little bit more about the website.
Thank you so much, Sam. So this virtual experience allows us to provide an internship conference that showcases projects from students across all of our campuses. Each student has recorded themselves presenting on their master's internship experience. These presentation recordings are being hosted on a webpage on the College of Public Health website. This page went live earlier today, so you can now access all of our fall 2022 presenters' presentation recordings. And we'll go ahead and pop that link here in the chat for easy access. But we've also sent the website link to our COPH community, as well as individually to all of our presenters for them to share with family, friends, their site preceptors, and anyone else who they would like to share it with. Presentations will be viewable in an on-demand format from today, November 16th, until the end of the day on Friday, December 2nd. At that time, the presentation viewing webpage will be deactivated. We encourage you to watch as many presentations as you're able to during the presentation viewing period. And for each presentation that you watch, we would ask that you fill out the presentation feedback form, which is linked on the viewing webpage. We so appreciate your support of the College of Public Health and of our MPH students. They have all worked incredibly hard on their internship projects, and we're very excited for you to view their presentations in order to really see the ways in which they are helping move public health issues forward in our communities. We have now come to the end of our live student highlight event. We sincerely appreciate you all joining us this afternoon. And again, thank you so much to our fantastic student panelists. We hope you enjoy watching the student presentations and have a fantastic day.